Hi everybody, my name is Tammy and I'm a doctor of physical therapy. In this video, I'm going to talk about neck pain that is associated with headaches. If you haven't watched the video where I go over the 4 physiotherapy diagnoses of neck pain, I highly recommend that you do so because you will get a better understanding of what we're doing in this video. Before you do any of these exercises, please read the indications, contraindications, and red flags that are listed in the description for you. So some of the symptoms you might be having with this condition is pain on one side of your neck that is associated with a headache that usually starts in the back of your neck, comes all the way to the front, and might even go behind your eye. You might also sometimes feel this headache and the neck pain right in the center of your neck. Right across where your skull is, so where your neck meets your skull, you might be experiencing pain over there. The other symptom you might have is that if your neck is in a certain position for a period of time, it reproduces your headaches. So if you're sitting like this or you sleep on it in a wrong way, it can create that headache again. You might also be having weakness in your neck muscles. And now, as always, if you are seeing a therapist for this condition, they can help you much better. But I'm going to go over some exercises that can definitely help. The first couple of things you can do at home is try to use an electrical stimulation. You can definitely try to ice it, and you can massage it with your hands. So again, you can go right from the bottom of your neck and in a circular motion, try to massage those muscles in your neck. Then you can come up. When you get to your neck muscles, if you go in the center of your neck, you will feel those bumpy prominences. Those are the spinous process of your neck vertebrae. So what you're going to do is you're going to put your hands right in the middle and try to go out towards both sides. So if I put my hand right in the middle where that bone is, and from there I'm going to go to either side. You can also do like a circular motion to try to alleviate pain in any tender spots you have in your neck. And if you ever go over a point that is super painful, not in the neck, but in the upper part of your shoulder, if you go over those tender spots, those are trigger points, and you can try to release them. I have a video where I go over how you can help reduce pain in trigger points, but easiest way is just to try to hold pressure on that spot for about 30 seconds to a minute, and the pain should subside. Now we're going to get into the fun part, which is the exercising. Now, as always, I've broken this up into the 3 parts, starting with the acute stage, which is from day 1 of your injury to week 6 of your injury. Remember, at this stage, your tissue is still super sensitive, so we have to be gentle with the exercises we're doing. The first set of exercises I want you to do are neck range of motion exercises. I have created a video where I go over all these exercises in detail, but here I'm going to quickly review them with you. So each of these exercises you're going to hold for 5 seconds, repeat 10 times on each side, starting with neck flexion. Again, make sure you're sitting up tall for all these exercises. You are going to bring your chin all the way down towards your chest. Pain-free range of motion. So you shouldn't be feeling any pain. If you feel pain, you stop before you get to that point. You hold it for 5 seconds and come back to center. The second exercise is going to be neck rotation. So you're going to bring your chin towards your shoulder. Again, pain-free range of motion. You might be feeling a little bit of a stretch on this side. That's okay. Just no sharp shooting pain. You hold it for 5 seconds. And I'm going to show you on the other side. Just going to take my chin towards my shoulder, hold it for 5 seconds. The third exercise is going to be neck side flexion or lateral flexion. You're going to just bring your ear towards your shoulder, hold it for 5 seconds, come back up and repeat on the other side, and come back up. The last range of motion exercise is going to be for extension. So you're going to sit up tall and bring your neck all the way back. Hold it for 5 seconds and come back to center. If this is painful, you can skip it altogether, or you can use your hands to help you. You put your hand right behind your neck and now go all the way up. Look at the ceiling, hold for 5 seconds and come back to center. The second set of exercises you can do at this stage are neck stretches. I have a video dedicated to neck stretches. I will leave a link in the description section for you guys so you can refer to it, but I'm going to go over one of those stretches with you. What I want you to do is take your hand, put it right behind you if you don't have shoulder issues. If you have shoulder issues, you can just leave it on the side. You're going to tilt your neck to one side, bring your hand overhead, and gently apply a little bit of overpressure. We're going to hold this stretch for 30 seconds, repeat it 3 times on each side, and you should be feeling a really nice stretch right over here. I'm going to show this exercise to you on the other side. So again, take your hand, put it right behind you, tilt your neck, bring your arm up, and apply a little bit of overpressure, and hold it for 30 seconds. The next exercise I'm going to show you in this section, it's something that I've talked about before as well, and I'm pretty sure if you've ever seen a therapist, they've told you to do this, but we are going to change it a little bit. So the exercise is called the chin tuck. You're going to find a comfortable position, sit up tall. You're going to try to bring your chin backwards towards the back of the room. So I'm not going down, I'm not going up, I'm just gently pushing my chin back, holding it for 5 seconds, and relaxing. It's best if you do this in front of the mirror for the first few times so you know you're not going down. As you bring your chin back, you should be feeling a really nice stretch in the back of your neck. Now what you can do is you can apply a little bit of overpressure with this. So I'm doing a chin tuck. Now with my hand, I'm going to push back a little bit more. So if you want, you can actually take your other hand behind your head, put it right there for a little bit more support. So push backwards, and with this hand apply a little bit of overpressure. Now you guys, I'm applying maybe 10% of my maximum force. It's a gentle overpressure. You hold it for 5 seconds and relax it. Again, let's try that one more time. Do a chin tuck and apply overpressure. I'm going to show you this exercise in a side view. So make sure you're sitting up tall. You're going to take one hand, put it right behind your head. With the other hand, we're applying the overpressure. So first, make sure you do your chin tuck, then put your hand, apply a little bit of pressure on your jaw. So I'm pushing my neck further back, and the hand on top of my head is giving me a little bit of support. Gonna hold it for 5 seconds and relax. The last 2 exercises I'm going to teach you are cervical mobilization exercises. Again, I have a video dedicated to these exercises, but I'm going to review them here because these are the most effective exercises to do if you're having neck pain that's associated with headaches. So all you need to get from me is a towel. You're going to put the towel on the top part of your neck. That's where most of your pain is. And make sure you're sitting up tall. So you're sitting on a chair that has good support. And the first exercise we're going to do is going to help with extension. So you're going to bring your hands close to one another. And I'm not moving my body, I'm only gonna move my neck. As I look up, I'm going to bring my arms up and then back down. Now, with my hands, I'm providing a little bit of force forward and up, okay? Not too much, you don't wanna make things worse, right? It's just a gentle support so you can get into a deeper extension. So again, go right on top. You're going to look up as you bring your arms up, keep your elbows together, come back down. You can repeat that a couple of times, then move down 1 vertebrae. Again, as you look up, you bring your arms up and slowly come back down. Again, move down. So you're moving down through those bumpy spinous processes in your cervical spine, right? And again, you can go up and back down. And then right afterwards, see if it made any differences. Maybe your neck pain is a little bit more, but maybe you don't have that headache anymore, right? If that's happening, that's a good thing. It means this exercise is helping you. If it's aggravating your headache, I would avoid doing it. Again, consult your healthcare provider before you do any of these exercises. And now the second exercise we're going to do in this position is a rotation movement, and according to the best practice guidelines for physical therapy, this is #1 exercise for this condition. So what you do is you bring the towel, the edge of the towel, right on the top part of your neck. From here, we're going to again switch our grip, okay? You can do it not switching your grip too, but this is an easier way of doing it. So you're going to stabilize with, if I'm rotating to this side, I'm going to stabilize the towel on this side. With my other hand, I'm providing a forward and rotational movement, okay? So as I rotate my neck, I'm providing that pressure with my hand to go all the way to one side, and then I come back to center. And make sure that towel stays right on top of your neck, stabilize with one arm, and help rotate with the other arm. And make sure you're not rotating your body, right? This is not the movement. The movement is just for the neck. And then come back to center. And you can repeat that a couple of times, maybe 5-6 times. See what happens. See if your neck pain and your headache becomes less. Now you can try it on the other side. So again, make sure you switch your hands. Stabilize with one arm. With the other arm, you're providing that forward and rotational movement. And come back to center. Again. And come back to center. Now, if you truly are a client that has cervicogenic headaches, this should really alleviate your pain, but you have to make sure that you're also being mindful of your posture. If you do these exercises and then 2 seconds later you are at your desk like this, your symptoms are going to come back. For the neck mobilization exercises, I recommend that you do them about 5 to 10 times on each side, depending on how severe your condition is. You can break it up and do it a couple of times throughout the day, but make sure not to wait until your symptoms come back before you do these exercises. So if you do them, you feel better, try to do them a couple of times a day so your symptoms are not reproduced. Okay guys, now for the second stage of recovery, which is going to be the subacute stage, that is week 6 to week 12, I want you to basically do the same exercises we did in the acute stage, but now you want to really make sure that your posture is perfect. So in order to do that, we are going to add scapular squeezes into our daily routine. Also, you can try to do any light strengthening exercises for the upper back. Again, I have a video for that. I will share it with you in the link below that you can follow. But here we are going to do the scapular squeezes together. You're going to sit up tall, bring your elbows by your side. You're going to squeeze your shoulder blades back, hold it for a count of 5, and relax. Again, squeeze your shoulder blades back together. Hold it for a count of 5, and relax. Okay guys, the last stage of our recovery is the chronic stage. This is if you had this pain for over 12 weeks. That's 3 months. I hope if you still have those pains that you have seen a therapist by now, because obviously they can help you much better. But again, if you're at this stage, you're going to do all the exercises we did in the acute and subacute stage with emphasis on correcting your posture. So at this stage, we are going to progress our strengthening exercise for our upper back. There are many exercises you can do at this stage, and again, I have a strengthening workout program for the upper back that I will provide the link for you guys that you can do. But here I will go over my 2 favorite ones, which is going to be a progression of the scapular squeezes basically. Again, you need to use a band for this. If you guys don't have a loop, you have a normal TheraBand, or you can even use a belt. I will provide the link of where I buy these from Amazon in the links below, and you can definitely buy these, or you can use whatever you want. What I want you to do is you are going to find a comfortable position, sit up tall, have your hands by your side, and start your scapular squeeze. Then open up your hands, hold it for 1, 2, 3, 4, 5, relax. Again, squeeze, open up, 1, 2, 3, 4, 5, relax. and you're going to do this exercise 3 sets of 10 reps, holding each position for 5 seconds. My second favorite exercise for strengthening the upper back is going to be a variation of the scapular squeezes. Basically, it's a progression of it. So what I want you to do is you're going to bring your arms forward, create that tension between your hands, squeeze your shoulder blades back and down. You're going to bring your arms in and out. Okay? Again, I have gone through these exercises before in my other videos, but they truly are super effective, and even with doing 5-6 of them, you should already be feeling a burning sensation of the muscles working out in your back, and that's great. That's what we want. Again, you're going to do 3 sets of 10 reps of these exercises for me. Other exercises you can do at this stage are all your neck stretches. If you are a person who's going to the gym, you can definitely start doing your row exercises, your lat pull downs, and if you're not a gym goer, don't worry, I have all these exercises in a video for you later on that you can do. Now, another exercise that is great to try to incorporate at this stage of recovery is going to be thoracic mobilization exercises. That is upper back mobilization exercises. I have a video that I will share with you guys and that goes over this in more detail, but here I'm going to show you an easy one you can do using a chair. So what I want you to do is find a chair that the back of the chair is not too high, and you're basically going to sit all the way back. You're going to bring your hands behind your neck, and what I want you to do is try to keep your elbows together, and you're going to look all the way up. So as I'm moving my body up, the chair is providing pressure, a forward pressure on my upper back, right? So I'm going to hold it here, I'm going to go all the way back, and come back forward. If I want, I can move up and down on this chair to mobilize different parts of my upper back. So I want to go a little bit higher. I'm going to come a little more deeper into the chair, bring my hands over my head and go back. And then you will feel where most of your restriction is. And you can try to do that a couple of times in each area. And eventually you will hear that popping sensation in your back, which is great. It means restrictions are opening up. There you go, guys. Now you have it. And these are all the exercises that are recommended for someone who is suffering from neck pain that is associated with headaches. Just remember that if any of these exercises are increasing your symptoms or you are not sure about doing certain exercises, please consult your healthcare provider before you start doing them. And as always, if you have any questions, please contact us or leave a comment for us. And if you liked the video, go ahead, like, share, and subscribe to our channel.